So today's webinar is called Lids and Lasers. And just pardon me while I mess around with this here for a minute. Um, and so lids and lasers, and we're going to be talking to you about what to expect before, during, and after eyelid surgery and laser treatments. And so I wanted to, let's see if we can advance here. Okay, we'll try the click button. So first, just right off the bat, your time is valuable. By the way, this is be a slightly long webinar. Feel free to duck out whenever you need to, but I really wanted to take the time to try to answer all of the potential questions that people may have about eyelid surgery and lasers. So I'm going to go through a lot of stuff. But why do I consider eyelid surgery a valuable investment for my patients? Well, the first is that my core training was in ophthalmology and I really value vision. And so if you look at the patient on the left side of the screen, those terribly droopy eyelids are blocking her pupil and making it hard for her to see. What you see above that, those black circles, are called a visual field test. And so what that's showing is that her eyelids are actually cutting off the top part of her vision. That black means areas she's not seeing, whereas white is areas you're able to see. And then if you look on the right after eyelid surgery, it shows that the vision greatly improves and the areas of vision loss are now restored from eyelid surgery. So the number one thing is I do a lot of eyelid surgery simply because people's vision is affected. And it really can make a difference in quality of life. Another more subtle reason that people don't realize or talk about is that our eyes and our face are responsible for a lot of nonverbal communication. And so when we talk to other people or look at their face, we spend 60 to 70% of the time looking at their eyes and eyebrows, what we call the periocular area. About 30% is looking at the mouth. And so we're always looking at people's eyes to give us cues as to how they're feeling. And so you can see the emojis to the right. I put in a few and I actually blocked their mouth because we really don't need to see a person's whole face to know how they're feeling. When the eyebrows, the outer corner of them tilt downward, like you see in the emoji picture on the top left, that is can be associated with sadness or concern. And then on the flip side, the picture right below it for anger has eyebrows that tilt down in the middle. And so those things can, let's see, yay, we can see each other. Okay, good. I'm going to X out of this right now, just so that it's not in your view either. But so anger is when the middle of the eyebrows dip down. People can look tired or bored when their eyelids drop down and cover up part of their pupil. And then, especially when you have droopy eyelids and one eyebrow is higher than the other, sometimes people even look contemptuous and certainly bored. This is an example of a patient who is a really engaging, beautiful, warm person, very bright. And yet on the picture on the left, it's like, how's she feeling? Is she tired? Is she disinterested? And then after eyelid surgery, her eyes are bright, they're friendly, alert, and youthful. So it's not just about appearance, it's about vision. It's about what kind of message you're sending into the world. And a lot of my patients have told me after eyelid surgery, people just respond to them more positively. And I think that that's a really interesting side effect to eyelid surgery. So rejuvenated eyelids, eyebrows, and skin can make us look younger, more attractive, and more kind. This is another beautiful, kind person who, after eyelid surgery and full face laser, just looks completely refreshed, but she looks like herself. We did a forehead lift, and that helped with the wrinkles in the forehead and helped put her brows in a more natural position. We did an upper lid bluff to restore some of the eyeshadow platform, a lower lid blepharoplasty to remove puffiness and tighten tired looking under eye bags. And then full face laser resurfacing improved the quality of her skin to a younger and healthier appearance. So my philosophy as a surgeon is I want my patients to look natural and I want the surgery to be undetectable. What I mean by that is I don't want it to look like you had surgery. I want you to look like the best version of yourself, like you just had a really great night's sleep. And then finally, surgery should look natural, not just at rest, but also in motion. So somebody might look great in a before and after picture, but then as soon as they start talking or moving, they look unnatural. Their face and their eyes don't move naturally. They don't blink fully or they look pulled. That's not the goal at all. And so we want things to look natural at rest and in motion and surgery to be undetectable. And then this is an example of a man who had an upper lid bleph and a lower lid bleph and lower lid laser resurfacing. And you can see surgery is not just for women, it's for men too. So, a little bit about my background. It's all on our website, so I won't belabor it, but I joke I went to school for 26 years. I've always been interested in medicine. I was lucky to do research in Parkinson's disease as an undergrad, then went to med school and residency in Philly, and followed that with 2 years of oculoplastic surgery fellowship at Duke. Board certified by the Board of Ophthalmology, and I'm a fellow of ASOPers, which is the Oculofacial Plastic Surgery Society. Um, and a little more on that. So why choose an oculofacial plastic surgeon? I love my training. I'm really thankful for it. We're board certified ophthalmologists, so we understand the complex nature of the eyes. The eyes are delicate. There's a lot going on there with eye health. But then on top of that, we spent 2 years just doing eyelid, upper face, laser surgery. So I did about 1,000 eyelid cases in training, which is a lot. We had to pass an additional oral and written board, and then there's only about 25 training spots per year. And then currently in my practice, I've been at Virginia Eye Institute for 7 years. And if you count every single eyelid I operate on, and procedures I'm doing in the operating room and in the office, I'm doing about 100 cosmetic and reconstructive procedures every month. So all I do is eyelids. I won't cut your nose, I won't do a facelift, but just eyelids, and that's my passion. And then finally, even in the hands of fabulous surgeons, not everything always goes 100% perfectly. And so we're the surgeons that are called upon to rescue suboptimal results with revision surgery when things don't go exactly as planned. So, if it's fallen, we find a way to try to lift it and so forth. So that's our jam. Just some pictures of giving lectures. And then thank you to my patients who have allowed me to use your photographs to educate other patients. Every picture you see here today has been used with written permission. I will never use your pictures without your permission. So please don't take screenshots of these images. And then, of course, the legal language is this is general advice. I'm sorry, just general information rather, not medical advice. And so please come see us for a consult so that we can give you your own personalized information. So today we're going to demystify eyelid concerns, upper and lower, who's a good candidate, how to prepare for surgery, what's surgery like, and what's recovery like. And then laser treatments. What concerns can lasers treat? Who's a good candidate? And tell you a little bit about some of our favorite laser treatments and why, how they work, what's the treatment like, and what's the recovery like. And then we'll answer with some Q&A. So we're going to start with upper eyelids. There are three main reasons why upper eyelids can be heavy or droopy. The first one, number one, called dermatochalasis. That's extra upper eyelid skin or fat. And so that's the picture directly adjacent to it, where that skin is sagging over the lashes. A second cause is when the muscle inside the eyelid is weak or stretched out. And that causes the eyelid, like the pulley system that opens the eyes, to be droopy, and the eyelids can droop towards the pupil. Sometimes people call that bedroom eyes. It's an old term, I guess. And then lastly is eyebrow position. So the eyebrows are almost like a curtain rod, and the eyelids are a curtain. And so if your curtain rod has drooped down, the fabric or the eyelids will sag. And so sometimes the problem is the curtains, and you need to tailor those. You need to do a little skin removal and treat the eyelids. But sometimes the problem is not the curtains, or it's both, and you need to lift the eyebrows back to their more rejuvenated position to really frame the face. And so they all kind of work in collaboration. So with extra eyelid skin and fat called dermatochalasis, there's three pictures of varying severity here. We treat that problem with an upper eyelid blepharoplasty. And that's when I remove some extra skin and any puffy fat to help improve the contour of the upper eyelid skin. There's an incision that goes in the eyelid crease, and those stitches are removed or dissolved after about a week. And so I'll show you a few before and afters. And so this is a patient, but all the before pictures, by the way, will be on the left, and all the after pictures will be on the right. So we worked on her upper eyelids, and you can see more space for eye makeup. And then lower lids, we removed some puffiness and lasered the skin to improve that as well. Here we did an upper eyelid blepharoplasty on a beautiful woman whose eyebrows are a little fuller, and this gives an example of just doing eyelid surgery and the improvement you can see. And then a man, and men, it's really important for men to continue to maintain their masculine look. We don't want to hollow out their eyes or feminize their eyes, but we want to help them see and rejuvenate them. And so I think he had a really nice result that speaks to his natural aesthetic and his masculinity. And yet another example where we treated upper eyelid skin and puffiness under the eyes. And so that really, I think, brightened her up really nicely. And that's 2 months after. So next is some examples of eyelid ptosis. And like I said, that's when the muscle inside the eyelid gets stretched out or doesn't function as well, causing the eyelid itself to fall down. And there's, again, some examples below. And so it can be mild, moderate, or severe. And generally, there's two main ways of fixing eyelid ptosis within the eyelid. One is the main lifting muscle in the front of the eyelid called the levator. And the other way is to do it internally without any skin incisions through the backside of the eyelid called Mueller's muscle. And that can give a little bit of a lift, but not as much lift as a front of the eyelid surgery can. So front of the eyelid's usually my favored approach, but for the right patient, I love going on the back side of the eyelid too. So some examples of before and after. And the key with a good upper eyelid ptosis repair is it's really hard. I try really hard to get good symmetry and contour. It's impossible to get it perfect. I say eyelids are sisters, not twins, but I really fuss with it and I don't quit until I feel like I've gotten it as equal as I can. The other thing is you never want the eyes to be so wide open that they show the white part of the eye above the colored part of the eye. That can make people look startled, scared, or just, it's too much. So these are all, examples of people who had droopy eyelids and we open their eyelids wider. This lovely patient is a great example of opening the eyes wider, dramatically improved her vision, really improved her aesthetics, but we did not do anything other than open the eyelids wider. We just made a small incision in the eyelid crease, found that droopy muscle and tightened it to open the eyes. We did not do a blepharoplasty, which is removing that extra skin and fat. In a lot of cases, what happens is insurance might cover ptosis surgery because the ptosis is in the way of the vision, but they might not cover the blepharoplasty because the skin is not in the way of the vision. And so we look at each case individually in terms of what each patient has for needs. And I always do my best if something is medically necessary to try to get insurance to approve it. But this is an example of how skin folds can be more prominent after ptosis surgery without a blepharoplasty. And kind of a little analogy to this is the Roman blind. So on the left, the blinds are halfway open. So it's like a pulley where the fabric has sort of only bunched up a little bit because the blind's not all the way open. But when you open the blind up more, you notice that the fabric or the skin bunches up just a little bit more up top and you can't see as much straight fabric of the blind, just like you can't see as much of the eyelid platform. So not every patient who has ptosis repair also needs a blepharoplasty, but it's something that we discuss in the consult. And this is a more dramatic example of somebody who, on the left, before surgery, we have a droopy eyelid. And then on the right, in the top picture, it's the skin fold was really bothersome after ptosis surgery. And so he elected to come back and just have me do a little cosmetic blepharoplasty to even out that skin fold a little bit. The last factor for upper eyelids is drooping eyebrows. And the eyebrows really frame the face, not just above the eyes, but the heaviness between the eyebrows, what we call the glabella, the very top of the nose between the eyebrows, that usually goes along with it. And so with birthdays, weight loss, sleeping on your face, which is my favorite thing to do, just life, the forehead seems to descend a little bit. And with that, the brows come down and the skin between the brows comes down and gets heavier too. And so lifting all of that up can be really rejuvenating. So drooping foreheads will often make it look like the eyelid skin's a little more saggy and can even create that concerned or angry appearance that's not a true representation of your emotions. So my preferred approaches for brow recontouring is one, if it's mild, hey, let's do a little Botox. We can put some relaxing Botox into the muscles that pull the eyebrows down, and as a result, you get a little bit of a lift. When somebody medically has very heavy eyebrows and they're in the way of the vision and we're not at all worried about aesthetics, the most dramatic way to lift an eyebrow is to make an incision above the brows. I tend not to favor this when we're at all concerned about having a visible scar. And then lastly, my favorite approach for the right patient is to do a pretracheal or trichophytic approach, which is done at the very front of the hairline here. And so this is a great approach for somebody who has a taller forehead because the result will shorten the forehead. And the scar usually hides pretty well in the front of the hair when it's fully healed. However, it's something I discuss with my patients. If you're somebody who really wears their hair back in a ponytail all the time, there will be a period of time where the scar is a little bit more pink and inflamed looking, and it takes time for it to calm down. And while I'm very meticulous with doing the surgery and the closure, I can never control how people heal. So we'll get into that more. But people get really scared when I suggest a brow lift because they're afraid they're going to look windblown, like they had bad plastic surgery. And they say, you know, I saw this woman at the mall, she had a brow lift, she looked terrible. And I said, well, you're only noticing the people who had a bad one done. You don't notice when the brows are repositioned back into their more youthful position. You should never look like you're walking around surprised. The eyebrow height should be put in a position that's appropriate for each individual's face, with the contour sort of representative of their natural structure of their face, as well as gender, because men tend to have a lower, flatter brow, and women tend to have a higher, more arched brow. So we kind of want to listen to your natural anatomy. This is an example of somebody who just had a forehead or a brow lift, no eyelid surgery. And while it's not a 100% correction, you can see it's a dramatic improvement, especially when you look at her eyelids compared to where she started. This is a patient who came in, she's so nice, but she came in kind of looking angry or upset. And her eyelids were heavy, but her forehead and her eyebrows were really heavy. And then here she is 3 months after. Her eyes are so bright to match her personality. You can see the incision line a little bit right up here in the front of the hairline. And this is 3 months after, so it's still a little pink. It's going to continue to fade. A lot of my patients choose to do a sweeping bang while they're healing from this procedure, and that covers it up great. Here's an example of somebody who just had a forehead lift, no eyelid surgery. At 5 months after, you can see the improvement in the forehead wrinkles, the brow position, heaviness between the brows, how open the eyes are. And again, that incision line, you know, you can't get away from the fact that it's there, but at 5 months, it's still going to keep getting better. And the design is such that we try to even get some little hairs to grow through it to help camouflage it too. This is more of a medical brow lift, and this is a great example of the perfect candidate for this. He has bushy eyebrows, he's older, he has some wrinkles. That scar is just going to end up looking like one more wrinkle or maybe even be hidden by the eyebrow hairs. So he was a great candidate for that medical right above the eyebrow lift. 4, I'm going to briefly touch on this. This is where it gets tricky and each person's consult's unique, but your brain actually affects your eyelids. So when our eyelids are droopy, we use our forehead a lot to try to lift our eyes open wider. And so the patient on the left has a little bit of ptosis, some droopiness to her lids, and her brain knows that. She's like, I want to see. So she's stretching her brows up. After I've fixed the droop, her whole face relaxes because she doesn't have to fight to see anymore, and the eyebrows come down. So it is a factor, and especially if somebody has uneven brows that they want corrected and they have a one droopy eyelid, those can interplay with each other. And sometimes I'll say, look, let's fix the lids and come back to the brow because your brow position might change after surgery. And this is a perfect example of this. She was right eye dominant. And so her droopier right eyelid, which is screen left, I'm sorry, her droopier right eyelid, which is on the left side of the screen, she's pulling up with her brow. You can see that with the arrow. And then after I fix the droop, boom, the eyebrows are even. So it's just the tricky fourth factor that I'm thinking about during your consult. So lower lids. People really dislike their under eye bags. And I know after I've had a salty meal, I wake up the next morning and I'm like, oh, they're puffy. And so there's 4 main things that people have concerns about with their lower lids. One on the top left corner is puffiness of fat. And that's when people say, I have bags, I have puffiness. The next is when you have some sagging skin on the cheekbone below where the fat is. And this is more loose skin, muscle, and sometimes some fluid that gets stuck in there. And then down below on the bottom left is what we call the orbicularis jelly roll. That's a little bit of skin and muscle. That's muscle in particular that supports the oil glands in the eyelid called the meibomian glands. And so you need to be very careful about chasing this area of minor puffiness because we don't want to cause any harm to the lubrication of the surface of the eye or harm the support to the eyelid. And then lastly, hollows. Sometimes hollows are accompanied by fat right above it, and that's the bottom left picture, bottom right picture. And sometimes hollows are just hollow. And so in each case, there's a different treatment for it. So when a patient has just fat, that's the only problem, we can often remove that fat with a lower eyelid blepharoplasty. All of my blepharoplasties are done through the inside of the eyelid because then I'm not traumatizing that important supporting muscle underneath the eyelid. And I find I don't run into problems where people's eye shape changes with that technique. So in this example, I just removed puffy fat, and then I love my laser, so I lasered the skin under the eyes to help tighten that up as well. Just a little PSA, there are no safe injections to melt fat in that area. There's a product called Kybella or deoxycholic acid is the ingredient that's injected under the neck to melt fat. And I've seen in doctor blogs and stuff where people have tried injecting it under the eyes to melt that fat. It's a terrible idea because fat is also surrounding the nerves that go to the muscles that move your eye. It's very inflammatory. So please don't ever inject something to truly melt the fat. Lastly, there are no effective and safe creams to melt fat. There are some creams that can contract and temporarily push back the fat, but nothing that's permanent. Okay, so under eye hollowing. The treatments for that are filler, hyaluronic acid filler, which is a gel filler. That's the filler that's reversible if we don't like the appearance or it migrates or for whatever reason you need to change it. And then PRF or PRP, you may have heard of platelet-rich plasma or platelet-rich fibrin. And so we can inject that into the area of hollowing to help stimulate your own collagen. My favorite technique is under eye fat transposition blepharoplasty. And that's an example right over here to the right. And so in this case, I took her fat that she already has there, removed it from where it was puffy and tucked it down into the hollow spot. And so we call that a fat transposition. It's a great technique in the right patient. Not everybody needs fat transposition, but it can be a really awesome option when somebody's puffy and has a lot of hollowing down below. And then lastly is fat transfer. That's when you take fat from elsewhere in the body and inject it into the hollow areas. It can be a great technique for some people, but it should be done with caution. One of the reasons is it's harder to change it once it's injected, and sometimes the fat will, you don't always keep all of the fat you injected. So it's a little bit more variable, but there are absolutely beautiful results that can be achieved with that technique too. And so the next option, or not the next option, but the next concern is festoons or malar mounds. And that's when you have puffiness on the cheekbone. And so treatment options are the whole smattering of things I list below, which is one of my favorite jokes is when there's 14 ways to do something, it means that there's probably not one best way to do it. And that's kind of how I feel about this area. It's a really tricky area because it's laxity of the skin and the muscle, and it has to do with ligamentous attachments. And sometimes really the only great way to get rid of all of it is to have a facelift and a lower lid bleph and a laser and microneedling. But we can dramatically improve it with just eyelid surgery and laser. And so I never promise anyone I can completely get rid of this area, but I can improve it. And this is an example of that there. And then we touched upon that muscle that sits on the front of the eyelid, that thick orbicularis or jelly roll. And I put in some cool pictures here. So the arrow is pointing to the area where in the eyelid, right below the lashes, it's where that muscle is a little thick. But you can see in this picture, it's right adjacent to these glands. And over here, you can see these glands line the eyelid, and they're what produce oil. So if you strip the muscle away from the eyelid in that area, you no longer have a pump that's going to squeeze the oils out of those glands. You'll be more prone to dry eye, clogged oil glands called chalasia, and even more prone to the eyelid sinking down and retracting because you don't have that strong muscle hammock holding it up. So what do I do to fix this? So Botox is my favorite go-to. Just a couple units often softens it. And then with extreme caution, I will do a skin excision. I will rarely excise any muscle for the reasons I had said above. And so this is an example of a patient who had surgery. And the below picture is her after result. And I think she looks great. And I think she was really happy. It's just that you can still see a little puff under the lashes. And that's the one that I tell people, you're 90% of the way there and we're going to stop because it's a great improvement and I want to keep your eyes healthy. So techniques and considerations when doing lower lid blepharoplasty is, do we need to remove fat? Do we need to reposition fat? Is your eyelid loose? Meaning if I do surgery, could it risk pulling down? And if so, do I need to tighten that ligament called a canthopexy? How is the skin quality? Do I need to do some laser resurfacing and improve the skin? Do you have so much extra skin that I need to remove a little bit of skin called a skin pinch? And most commonly, we don't need to do that. We can actually do this as a completely scarless procedure with working through the inside of the eyelid and doing some laser on the skin. And then do I need to think about any special techniques to prevent those lower lids from falling down? And that happens particularly in my patients who have really prominent eyes. Maybe it's just how they're built, or they're really nearsighted, and so their eye is long. Or some patients just don't have very prominent cheekbones, and so their cheekbones don't support their eyelid, and so we need to think about that. And then have they had prior eyelid surgery? Is there any scarring inside the eyelid that needs to be released or considered as we approach this? Have they had prior skin cancer and reconstruction that we need to consider? So here's just a couple cases to overall talk about eyelids. This is a absolutely gorgeous woman. And when she came in, the first gestalt was like, you don't need a thing. And she really didn't. But everybody likes to improve themselves and they see changes as they age and have birthdays. And so what she had saw is that, or seen is that in her right eye, which is the left side of the picture, the upper eyelid had begun to become droopy. She had noticed some puffiness under her eyes, and she was unhappy with a little bit of extra skin fold that kind of made her eye makeup smudge. And so in her case, we did an upper eyelid blepharoplasty to help remove some of the extra skin fold, but we also did a ptosis repair to open her eyes up wider. And then a lower eyelid blepharoplasty with, it doesn't say it, I'm sorry, some resurfacing to help tighten under the eyes. And she has a great result, not just in this picture, but also in motion. Because when she blinks and talks, she just looks bright-eyed and alert and refreshed, like she just had the best night of sleep ever. This is another example of a patient who is just bothered by underneath her eyes. She has a slightly darker skin tone. And so in her case, she didn't have a lot of hollowing, so we just removed some puffy fat. And we didn't need to remove any skin or do any lasering because she really didn't have that many wrinkles. In my patients with skin of color, you have to be really careful with laser. Sometimes you can do a light resurfacing, but you're at risk of getting a little inflammation that causes hyperpigmentation or darkness of the skin after. And then same with incisions. You just want to be really careful about how incisions heal and could scar. And so we did this completely scarless. There's no visible incisions whatsoever. Another example, this patient had a upper eyelid blepharoplasty to treat some of the skin folds up top, and then a lower lid blepharoplasty with fat transposition to kind of smooth that junction between the eyelid and the cheek, and laser resurfacing to tighten the skin. So who's a good candidate for eyelid surgery? Good candidates are in good general health. They're able to stop any blood thinning medications or supplements. I've never had anyone lose vision from bleeding, knock on wood. And I tell everybody, and I don't want to start with you, so I'm really neurotic with my instructions, which starts with talking to my surgery coordinator, and she's going to go over all the medications with you and make sure you're stopping the ones that could potentially increase your risk for bleeding. You need to be able to follow instructions and commit to downtime. So I'm really serious too about, and we'll talk about it, no exercise after. I don't even want you bending over with your head below your heart to lace shoes. And so I really am strict about my aftercare because I want people to have a really good healing experience and have a great outcome. You need to have realistic expectations. I can improve things, but I can't make things perfect. I can't get rid of every last wrinkle. But I do think that for most people, I can make things better. And so we just need to talk about what your expectations are so that we can make sure that I can meet them. And if I don't think I can, I will let you know. And then lastly, it's my best patients who do the best have given considerable time and thought into the idea of having eyelid surgery, and it's something that bothers them enough to want to proceed with surgery. If it ain't broke, don't fix it. But if it's bothering you, let's have an educated conversation about it. People who aren't good candidates, uncontrolled high blood pressure. It's one thing to come into the surgery center and be nervous and your blood pressure's a little up, but your blood pressure shouldn't be up on a day-to-day basis because when you go home, I don't want your blood pressure being high. It increases the risk of bleeding. And on that note, bleeding disorders. If you have a condition that makes you bleed or you can't stop your blood thinners, not a good idea to have surgery. If you just have a lot going on in your life and despite your best intentions, you know you can't commit to the post-op instructions, let's wait until it's a better time. Active infection, that's pretty straightforward. Significant immune compromise. So sometimes people take medications for autoimmune conditions that can dampen their immune system, and we'll talk about them. It's not necessarily a strong reason why we can't do it, but if you're really prone to infections because you're on a strong medication or you have immunodeficiency or you have a cancer that puts you at risk, we really shouldn't be doing eyelid surgery. And then lastly, any eye surgery in the last 3 months. And we just want to make sure that your eye is strong and ready for surgery. Special considerations. So I operate on patients with these concerns. They're not necessarily contraindications, but they require really special consideration, discussion, and planning. Um, and that's why I really care about, understanding eyes and eye health and your eye health and your eye history. So dry eyes, sometimes eyes can feel a little drier after surgery. They usually return to their baseline, but if you're really, really struggling, that's something where you have to be mindful that you're going to need to use drops more frequently, potentially in the aftercare period. History of prior refractive surgery. So refractive surgery will thin the surface of the eye in different ways and make it more prone to changing its shape from changes in pressure. So if you have a really droopy eyelid and you've had prior LASIK, your cornea is a little thinner, a little more prone to changing its shape. And I lift your eyelid up to a different spot, it's now pushing on your eye differently. And it can ever so slightly change your glasses prescription, your refractive error, how light enters the eye. So same with keratoconus. So if you have had those procedures, there can be a little change afterwards. Does it happen all the time? Definitely not. But can it? Yep. Conjunctivochalasis. And that's when you have a little bit of fluffy extra skin on the eyeball itself, just like you can get loose skin on the eyelid, and that can just make you a little more prone to dryness or tearing. That stuff swells up a little bit after surgery. So sometimes I use some special drops or techniques to get us through that. Poorly controlled diabetics don't heal well, but diabetes and diabetics in general, as long as it's reasonably controlled, tend to do pretty well. We touched on immunosuppressant medications. Smoking, the issue with smoking is that your blood vessels expand, contract, and that really causes a lot of swelling, not to mention all the toxins in cigarette smoke. So you will have a protracted healing, meaning it's going to take you longer to heal than a non-smoker. Fibromyalgia, uncommon, but you can have prolonged pain from any time you do a surgery, anytime you have an incisional site. Patients with fibromyalgia, that can potentially act up afterwards. Obstructive sleep apnea. This is a big one, and it's really common. So people who have obstructive sleep apnea or really bad snoring tend to sleep on their side, which stretches out their eyelids. Also, they tend to have a type of collagen that can make the eyelids more prone to being stretchy. Stretchy eyelids don't tend to respond as well or stay put after eyelid surgery because they do tend to have a little more stretch and give to them. And so it can just make things more challenging. That said, if you have stretchy eyelids, consider getting tested for sleep apnea, especially if you snore, because you could have it and you could sleep so much better with the CPAP. We talked about when people have a negative vector midface or sunken cheeks, and then neurologic disorders. So I have patients who have Parkinson's, for example, that don't blink or close their eyes as well as they used to. So what is the whole experience like? And so first, call this phone number to schedule a consultation. And so this is an actual real phone number. Like there is a human, Lauren, who sits here and answers this phone. So if she doesn't pick up, please leave her a message and she will get back to you. But set up a consultation so we can discuss your concerns, review your treatment options. If things are bothering your vision or there's a medical issue, we try really hard to get it covered. So if need be, we do a visual field test. You'll meet with my surgery coordinator, Lauren. I have two Laurens. And she's going to give you lots of information on logistics, what to do before surgery, aftercare instructions, and of course, any pricing for out-of-pocket procedures. Lauren is the guardian of my calendar. And so if you decide to move forward, she can help you choose a date. She will talk to you about getting a preoperative physical scheduled within 30 days before surgery. That's a surgery center state law. And I typically do my surgery at our surgery center at VEI. You'll need to bring a driver to your procedure who can bring you home afterwards. Nothing to eat or drink after midnight, although the ASC will call you and they usually let you do a little bit of drinking a few hours before. Don't listen to me on that. La 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 la. Just go by whatever they tell you. I am not the judge and jury on that one. I don't want to get in trouble for letting anybody eat or drink. And then you need someone responsible to stay home with you the first overnight after surgery, because generally we're working on both eyes. Your vision could be a little blurry. We gave you some happy drugs. Most people do fine. They honestly usually don't need the help, but gosh, it is really nice to have the help if you need it. And then follow up. So day 1 or 2, if having a forehead lift, lower eyelid bleph or laser resurfacing, I want to see you back on day 1, maybe day 2. Not both, but one or the other. And then at 1 week, I want you to come back if you're having upper eyelid surgery or as your next follow-up for any of those procedures. And then, of course, if you have problems at any point, I want you to call me and we'll see you in between those times. But those are kind of my more structured follow-up times. So what's surgery itself like? So you'll be called by the surgery center with your arrival time the day before surgery. You'll come into the pre-op area. The nurses will check you in and go over your history, get an IV started. And you'll see me to ask any final questions, which hopefully you're very well prepared. And I'll put some marks on your eyelids to help guide me in the operating room. You'll meet my anesthesia team, and anesthesia can range from very light sedation with propofol so that you're just snoozing when I numb you up and then you're a little bit awake in surgery, to more deep sedation, to general anesthesia. And it just really depends on the case and each individual patient and what their needs are. My anesthesia team is great. I've worked with them for a long time. They will take very good care of you, as will the nurses at the surgery center. In surgery, obviously, sterile technique to prevent infection. I mostly do surgery with a CO2 incisional laser, and I find in my hands that helps reduce bruising and bleeding. And so, of course, I use eye shields to protect your eyes. And then after surgery, you'll initially do a little bit of icing. We'll make sure you're comfortable before we get you going home. The nurses will go over the instructions and follow appointment time with you and your caregiver, because sometimes we're a little groggy right after surgery. We don't rely on you to remember everything. That's why a caregiver is important too. But you'll have it all figured out before you get there. I know it. And then the nurses will help fit the lid lift goggles if you decide to move forward with that. Here's a picture of the lid lift goggles. And so you'll see a sample of those if you come in for consult. And so basically, the first 48 hours while you're awake, I want you to do either ice packs every 20 minutes. Of course, not ice directly on the skin, but protected in some way, or goggles. And the idea is that that's going to really reduce your bruising and swelling. I tell people, I think goggles with the compression work better than ice to reduce your bruising and swelling in the first, basically in the first 2 weeks or so after surgery, if you use in that first 48 hours. But your final result and how you look down the road, your final healing, it doesn't matter what you choose. So go with what works best for you. If you hate cold things, get goggles. If you're claustrophobic, you can't see out of these goggles. It's really annoying. So maybe don't get the goggles. Download some books on tape and some podcasts, and you'll get through it. It's only 48 hours of annoyance. And then what's great is I want you to protect your eyes at night for the first 2 weeks after surgery. And so we'll give you eye shields, and that's so you don't accidentally rub them when you're sleeping. You get an itch, you don't realize what you're doing, you rub. Well, the goggles protect your eyes, but also reduce the swelling that sets in overnight when we're asleep. So I think they're a really good tool for the right patient. But back to right when you wake up from surgery, it's normal for your vision to be blurry, and that's from the protective ointment that I put in your eyes. You might feel sleepy, take a nap, go for it, enjoy it. Discomfort should be mild to minimal to moderate, depending on what surgery you had, but it's usually well managed with just Tylenol. As long as people don't have liver disease, and that's one of the things I ask you about, and I'd want you to tell me about, but Tylenol, extra strength, up to 1,000 milligrams every 6 to 8 hours, usually does a pretty good job at controlling discomfort. And on top of that, it's just, most of these surgeries aren't all that painful. However, if you had more pain than you can control with Tylenol after surgery, I'd want you to call me, because one, I want you to feel better. We want to make you feel better, but I want to make sure nothing's wrong causing that pain. So don't be shy, don't suffer in silence, reach out. Okay, so you're at home, the first 48 hours, you're really bored because you're doing all this icing and goggling. But by day 3, you're done with that. And it's a great day because unless you have well water, it's okay to get in the shower. Just generally try to keep soap off the incisions because it stings, gently pat dry. If you have well water, I don't want you getting the well water on your face for 1 week because of a very rare risk of infection. And then day 3, as long as you feel like your vision's okay, you can drive. Through day 7, for anything with stitches, I have you putting on antibiotic ointment. If we do a lower lid surgery, I have you using antibiotic eye drops. I want people using artificial tears to keep their eyes lubricated. For 1 week, no strenuous activity. So I do not want you to power walk, exercise, bend over, lift more than 10 pounds. So you're wearing slip-on shoes, you're not bending over to do the dishes or the laundry. Just take it easy. Expect some amount of blurry vision that first week. It's not incapacitating, but the ointment is greasy and blurs the vision, so that's nothing to be alarmed about. And then sleep with your head elevated for 1 week. That will help with swelling. So through day 14. So a lot of things lighten up after day 7. You get to quit a lot of those things once day 8 hits. But through day 14, it's important you still sleep on your back with your head at least a little bit elevated. Don't sleep on your side. And then wear eye shields or goggles to protect your eyes while you're sleeping. On day 14, it's okay to resume your normal sleeping position, wear eye makeup, swim, use contact lenses, but we'll talk about these things in more detail if needed. Social downtime. So we have a little vacuuming situation out there. Hold on just a sec. So social downtime. What will I look like while healing? So day 1 to 2, you have a lot of work to do. You won't get much done. You won't want to go anywhere. You won't really care what you look like. But day 3, if your vision's okay, it's all right to go out and about. What's really nice about most of the surgery I do is sunglasses covers that area up. So throw on a big pair of Jackie O shades and you can get out and about. Day 7. So you're still going to have bruising and swelling at day 7, but the very worst of it is usually over. By day 14, most of the bruising has resolved. It's not uncommon for the area that follows gravity to still have a little bit left. Swelling will come and go though for a month. So I tell you, if you have a special event, I want you to wait at least a month before you have that event. It takes about 3 months for the upper eyelid scar to really considerably soften. Some people it's barely visible from the get-go, but some people it takes a little bit of time to soften. By 6 months, any incision lines, the pinkness has dramatically faded, and it takes a full year for the final scar appearance. That said, the severity of bruising, swelling, healing, everything varies from person to person. This is just a little gestalt. This is somebody you saw earlier who had uppers and lowers done. And you can see a picture of what she looked like at the top here at 1 day after surgery, 1 week after surgery, oops, and then 1 month after. And then lastly, this is a gestalt of 3 people with mild to the left, moderate in the middle, more significant bruising on day 1 after surgery, and then what they looked like 1 week after. And you can see that they're still bruised, still swollen, but it's a lot better. So part 2, I hope you're hanging in there. And like I said, I told you it was going to be long, but informative. Part 2 is we have lasers with Leisha. So Leisha is my amazing nurse, and she has her RN BSN from Bon Secours. She started her career in the NICU, so she has extremely steady hands from taking care of those itty bitty tiny babies. She worked with me in the PACU and the OR, taking care of my patients both during surgery and after surgery over at our surgery center. And she also worked in some of the ophthalmology procedures. So again, she's an eye girl. And she's been working with me in the clinic for the last 2 years. And so we've done a lot of togetherness and hands-on training. And I let her do my lasers and Botox, perk of the job. She's pursued a lot of specialized training as well, including laser training in Nashville with Dr. Rob, a Mohs surgeon who is really involved with Sciton, as well as Dr. Posner in Boca Raton. And so without further ado, I'm going to let Leisha take it over.
Awesome. Thank you so much. I'm excited to talk about lasers with you guys today. As a reminder, if you have questions or thoughts, just put them in the chat because we will talk about them at the end. So lasers are a big part of our practice, so I'm excited to talk about it with you today. So what are we going to talk about? So first is why Sciton laser technology. We have a Sciton laser here. What does a laser consult even look like? What are the different treatments we perform, and what's the process and recovery like for each of those treatments? So, ready for a little bit of laser science. Not all lasers are made equally. The result of a laser treatment is determined by 2 main factors. 1, the laser, and 2, the laser operator. So, this is the person who chooses the wavelength, the energy, and uses skilled techniques for each of the treatments, and we monitor your healing throughout it. So it's important that you choose a laser operator who knows what they're doing. So let's talk about the first treatment that we do. So BBL. BBL stands for broadband light. This treatment uses specific wavelengths of visible light to treat chromophores, which are targets in the skin. So the chromophores that BBL target are hemoglobin, which is blood. So this treats broken blood vessels, redness, rosacea, and also melanin. So that's pigment. So that's going to treat your brown spots and your age spots. So here you can see 2 different before and afters. So on the left, screen left, you can see the before and after primarily targeting the pigmentation, and that was after 3 sessions of BBL. And on the right, this is before and after 3 sessions of BBL as well, but that one targeted more of the redness in her skin. So you can see the dramatic change in the redness in her nose and on her cheeks after 3 sessions of BBL. So let's talk about Halo. Halo is a hybrid fractionated laser. So this treatment uses an ablative and non-ablative wavelength. That means the ablative removes channels of skin and non-ablative does not remove skin. This is done simultaneously to perform a skin resurfacing treatment. The best way to imagine this treatment is to think of it like an aerator to the skin. It's truly like that. It removes tiny plugs of skin and it replaces it with healthy skin. It also sends energy deeper into the skin, which stimulates collagen production. It removes pigment and it improves skin texture. Here you can see a before and after. You can see beforehand, she has pigmentation, uneven skin tone, kind of like that more dull skin. And then the after, just with one treatment of BBL and Halo, you can see how glowy her skin is, pigmentation is gone, and she has an even skin tone. So let's talk about TRL. TRL is the big guns in our practice. This is a deep laser resurfacing. It stands for tunable resurfacing laser. So this is a treatment that uses a fully ablative wavelength, which is our erbium 2940, and that removes layers of damaged skin in a controlled manner. This is performed by Dr. Langelier. It dramatically improves wrinkles and severe sun damage. This is very customizable. It's the depth of the treatment is adjusted based on each person's anatomy, specific skin concerns, and it's definitely individualized. So you can see here a before and after from a deep laser resurfacing. So before you can see the crepey skin under her eyes, the laxity, the looseness, and then afterwards. So this is 6 weeks after a deep laser resurfacing around her eyes. You can see a little bit of pink. That's going to continue to fade, but you can see the dramatic improvement in skin tone for sure, and the tightness under there.
And so in that picture, no surgery was done, just a laser.
Yep. All right, so you're thinking, let's do a laser treatment. Where do I start? Laser consultations. So our consultations are extremely valuable and actually required for a laser treatment. So what does a laser consult look like and what do we discuss during it? First things first, you're going to come in and fill out our very long medical history form, which we love.
It's not the Spanish Inquisition. I promise it will just feel like it.
It does. So this helps us determine if you are a laser candidate in general, and it ensures that we keep you safe. So it has a lot of questions about history. This is our top priority. So you meet during your consultation with Dr. Langelier and myself prior to any initial laser treatment. I perform treatments like the BBL, the Halo, lighter laser peels. Dr. Langelier performs our deep laser resurfacing, and I assist. Regardless of which treatment, you're going to see a lot of both of us. It's definitely a doctor-nurse team approach. So laser consultation. After we determine if you are an appropriate laser candidate, we then discuss which laser treatment to do. So we discuss things like your skin goals, your expectations from the treatment. We discuss your social downtime, how much you have available.
Hey, Leisha, can I play golf the day after a laser?
No.
Oh.
All right, and then we discuss each treatment in depth. So that includes the process of the actual treatment, what it looks like when you come in, and the process of the recovery of each treatment. Two things that people really are interested in. We look at the recovery pictures of each treatment, which is very helpful because you can see step by step what you would go through if you sign up for that treatment. All right, so let's talk about each treatment specifically. So BBL again stands for broadband light. What does it treat? So this treatment treats broken blood vessels, redness, rosacea, brown spots, age spots. Who's the ideal candidate? These people are lighter skinned individuals who want an improvement to their overall skin tone without downtime. It also used as a refresh to the skin in between more aggressive resurfacing treatments. And research shows consistent BBL treatments actually allows the skin to act like younger skin. It's pretty cool.
It's a crazy study. It changes gene expression. It's really neat
Yeah,
in a
it's really
positive
cool.
way. So it makes the skin act younger, more youthful, healthier.
So what's the treatment like? It feels like a hot rubber band smacking on your skin. I know it sounds really fun. It's tolerable, but it does involve some discomfort. I tell my patients it's not the most fun you're ever going to have, but we're going to get through it together. What's the recovery like? This is very minimal downtime. You're going to feel like you had a mild sunburn. You might experience some flaking of the brown spots, but it's pretty minimal. You're going to wear sunscreen after the treatment, and you can wear makeup right after. Yep. One point about it is a less invasive treatment means less dramatic results. So it's all about expectations from your treatment. It also takes typically 3 to 4 treatments, BBL alone, to see improvement. So next, Halo, my favorite treatment. What does it treat? This treats overall skin tone. It removes age spots. It improves pore size and softens fine lines and wrinkles. These patients are lighter to medium skin tone individuals. You can tolerate a little bit of downtime. Deeper skin tone individuals, you might be a candidate if we do multiple less intense treatments. We'll talk about it. This treatment works very well on sun-damaged skin. What's this treatment like? So the thing about this treatment is I often combine it with BBL treatment. That's the most dramatic result for sure when you combine it. If performed with the BBL is performed first. That takes about 45 minutes. I then numb your skin. That's another 45 minutes. And then Halo is about 45 minutes. Discomfort during the treatment, it feels a little bit of prickly, but it's tolerable. And then the thing about Halo and BBL combined, well, Halo alone too, is that the skin starts to feel really hot. So as I'm working from this side to this side, you'll start to feel this side start to feel really hot. By the end of the treatment, your face does feel extremely hot. What's the recovery like? Again, right after your treatment, your skin feels like it's on fire, honestly. It feels like that for about 2 to 3 hours. I tell patients, you're going to get through it. You just need to sit in front of a fan for 2 to 3 hours and then it goes away. Afterwards, the skin feels like mild sunburn for several days. Swelling is about 3 days, and then you flake off that dead skin and pigment for about 5 to 10 days.
We've both done it to each other multiple times.
Yep.
So, during the treatment itself, you get through it. But like she said, it starts getting the area she just treated starts getting hot. So we have this really cool icy cold fan called a Zimmer chiller, and we give that to you in one hand to blow on the side that is just been completed. And then right when you're done, like we said, we don't want you putting ice on your skin, but a fan can help. We give you this mask that can help as well. It just kind of cools things down, but it's very predictable. It's like 2 to 3 hours later, it's like, oh, it's gone.
It's wild.
Yep. So it's very predictable. We've done it to ourselves.
Yep.
We know what you're going through. It's
Yep.
going to burn, but it will get better. And it's really incredible results.
Yeah.
Ta-da!
Usually after the treatment, people will say, it was exactly how you explained, which we love.
Yep.
Results are, you can have amazing results after one treatment. If you do 2 treatments, you see further improvement. I notice a bigger improvement in skin texture, fine lines and wrinkles if you do 2 treatments. A lot of times people will do this once a year for maintenance. So here you can see some dramatic before and afters. So this is with one treatment of BBL for both of these before and afters. On the left, you can see before the pigmentation, and then afterwards, that glowing skin. Again, on the right, pigmentation overall, kind of like a muddy look to the skin, and then afterwards, that really healthy glow to the skin.
Yeah, so we love this because what you're seeing right here is one treatment. Like the patient came in one time for their one session, of course, a consult before. The BBL and Halo is done in the exact same setting, it's same session. And then you go home, and then this is the results after one treatment.
Here is another example. So this patient had 2 treatments with me. We had a little bit more improvement with skin texture after 2 treatments. So she was really happy with that. Here's another one. She had 2 treatments, didn't want to go through a deeper laser resurfacing, so we did 2 halos, and she got a pretty good improvement in the fine lines and wrinkles.
And given, everything comes with trade-offs, I should say. So usually the more incredible the result, the bigger the downtime. And so that's what we'll talk about a little bit with our big laser, our TRL. But this is sort of a way to, for some patients, shortcut that. It won't get rid of all the wrinkles, the deep wrinkles, but you can, with doing multiple treatments, get more improvement with periods of shorter downtime, which Leisha's about to show you.
For sure. All right, so this is a recovery from BBL and Halo. So before, and then day 1, you're gonna still have that redness and the browns are gonna start to get browner. Day 2, redness starts to fade and then you still have those browns and they get darker brown. Day 4, everything starts to kind of slough off on its own. And then you can see at 2 weeks, all of it has sloughed off and her skin is looking fresh.
And notably, day 1 looks like it would be painful, but it's really not.
It's not.
You're just a little swollen and red.
Yep, mild sunburn for sure. Here's another recovery timeline. So this was before day 1 again, red, brown spots. Day 2, they start to get darker, but not as much red. And then day 6, you can see that how amazing it just sloughed all off. It's amazing.
Goodbye sun damage.
Yep. And here's a full face of that. So good. All right, let's talk about TRL, the big guns. So what does this treat? This is our laser that treats wrinkles and severe sun damage. These are patients who are lighter to medium skin tone individuals. They want a dramatic improvement in their skin tone. They want their wrinkles dramatically improved. You must be able to tolerate some downtime from this, and you have to come into our office frequently, especially in that first week, for us to check on you. Most patients love that. They love coming in and seeing us.
We're going to be friends.
Yep, we're going to be friends. And that's really to keep you safe and to make sure that you're healing okay. So what's this treatment like? This treatment is performed in our office. Dr. Langelier does the treatment. I assist. And the actual treatment takes about an hour of her treating, but you can expect to be in our clinic for about 3 hours from start to finish. You're going to be prescribed most likely a mild sedative that we're going to have you take before the treatment. Once you come to our treatment, you don't take it beforehand. But pain management also includes things like that icy cold fan. We do tons of topical numbing, lots of numbing injections, Pronox, which is the laughing gas. And we really try hard to keep you as comfortable as possible during your treatment.
Yep. And so, the sedative, you're not going to go completely to sleep. You'll be able to respond to us. We don't want you completely to sleep. And the numbing, topical numbing is going to get you prepped for the little numbing injections that I do. People have varying levels of discomfort while I'm doing the numbing injections. Everybody's pain is sort of different. Some people have more pain from heat or from injections, that kind of thing. But I find that once we have you all prepped and ready to go, the treatment experience itself tends to be reasonably comfortable.
Right.
Yeah.
We're most worried about keeping you comfortable and you safe.
Mhm.
So you are on our mind the whole time. This is a surgical level laser treatment. So it is very important that it's done by an experienced provider who has done it and knows what they're doing to keep you safe. What's this recovery like? It's extensive, and we ensure that you are well prepared. We hold your hand throughout this whole process, and we are readily available to you. Like she said, we become close friends. Immediately after the treatment, we apply Aquaphor all over your face, and we ask that you apply it throughout the night. We see you that next morning. I actually meet you at our back door and I walk you in and I say, it's going to be all right. This is what we talked about. And then we do your first cleaning that first day. We talk about what you're going to do with your cleaning protocol. We see you multiple times that first week, and then we do monthly, weekly visits. After that, it's kind of customizable to how you're healing. We tell our patients bluntly, the first week you're going to look rotten. The second week you're going to look very red.
Still rotten.
Still rotten. Yep.
But red and
splotchy. After the second week, typically we let you wear a specific makeup that we recommend, and that hides the redness, and that redness can last up to 3 months. Since uneven pinkness can remain for up to 3 months, we really mentally prepare you for it. We want you to be ready for that.
Mm-hmm. So we're going to show you some pictures, but what I can tell you from experience is most people get through the first couple days no sweat with us, with us helping you out and holding your hand. But where people get frustrated is more like 3 weeks later, because you've just been through 2 weeks of like looking really nasty. Now it's the third week and your skin is healing, but you're just really red and splotchy and you're ready to just go back out into the world and be normal, but you're not quite there yet. And so this is where we watch you really carefully. We want to make sure the redness is going away and not turning into browns, which is pigmentation, making sure everything heals. But for the right patient who's highly motivated because they want to really improve their skin texture, little lumps, bumps, spots, they want to improve those deep etched in wrinkles, there's nothing better than this.
Right. Yeah. So here's some before and afters. So this was before and 3 months after. and you can see the improvement in the wrinkles, the texture, the sun damage. It really does look
Mhm.
refreshed.
That said, it's not a facelift, so it's not going to tighten and pull the skin back, but it dramatically helps with all of those things like the texture and
Yep.
the pigmentation.
It also is how deep your wrinkles and how much we can remove from that.
Mhm.
Here is her recovery. So before, and so at 2 days, you can see the redness, a little bit of pinpoint bleeding, still totally normal at that point. 3 days, she's starting to improve, swelling's gone down. 7 days, she has more of just that really deep pink color to her face. 2 weeks is usually when we see people start to really turn around. And then you can see the 1 month.
Mhm. And this is all without makeup. So you could imagine that if she put a tinted sunscreen or a nice pigmented base makeup on, that should be able to get out and look great.
Right. Here's another one. This is before, and 1.5 months. It's the same one we saw earlier. You can see a little bit of the pink still.
Mhm.
And here is her recovery. So before, day 1, day 2, 1 week, 2 weeks, and 1.5 months. And this is a very typical healing pattern here.
And so, like we said, you're looking really rotten the first few days. You're scaring people. But then by 1 week, you're not really scaring people anymore. You just still really red. And we still have you in grease to some degree. It's just kind of an annoying experience those first 2 weeks. But the first week is when the first few days is when you look the worst. And that's why we have you come in and see us multiple times that first week. Like the next day,
Yep.
we want you back to do your first cleaning for you to make sure that you understand how to do everything.
Yeah. And just another note about expectations. So you can see before the fine lines and wrinkles would not be improved with something like Halo. So if somebody comes in and they really want those wrinkles gone, we're going to say, well, the best recommendation is to do a deep laser if, all things match up. But it's expectations and which treatment is going to accomplish which.
Mhm. So just to wrap it up, some summary and final advice. I hope that, first of all, I hope this was informative. I hope you learned a lot. Whether you're local or far away, find a surgeon who is well-trained, who you feel like listens to your goals and can create a customized plan for you because you are not the same as your friend or your neighbor. And so just make sure that they take your eye health, your tolerance for downtime into consideration. And remember, this is your eyes and your face. Outcomes are never guaranteed, even in the most well-trained hands. Um, I try my very best, but setbacks can happen. So find a surgeon who can help you handle any issues that could arise during your healing, and that's going to be there for you. A great outcome is also dependent, is my third point, on not just the surgery, but the aftercare. So make sure you understand your aftercare and feel prepared for it and follow those instructions precisely. And then lastly, make sure that you have good goals. When you're fully healed, aim for an outcome that is undetectable and natural looking, both at rest and in motion, but also that preserves the health of your eyes. Please don't go chasing every last little wrinkle, droop, or sag to the neglect of, your eye health. I once had a patient tell me, I said, I wouldn't be able to remove any more skin. You wouldn't be able to close your eyes. And they said, that's fine. I said, no, it's not. That is not the common response that I get. But the point is you want this to be a healthy outcome. And then some compliments I've gotten from patients. How I feel like I went home at the end of the day and I know I succeeded is when somebody tells me I felt prepared. It was exactly like you said it would be. Um, I had somebody else say, no one knows I had surgery, but they keep telling me I look so refreshed. One that happened today was I really didn't want to have surgery. This isn't something I wanted to have to do, but I'm so glad I finally got up the bravery to do it. I am seeing so much better. Similarly, it's like someone turned on the light and took my blinders off. I didn't know what I was missing. I should have done this years ago. I'm so glad I finally did it. One of my favorites was I told you about the resting facial expression, and I think kids pick up on this. So I had a woman say that her granddaughter said she didn't look mean or she isn't mean anymore. And it's not that the grandmother was ever mean, it's just she no longer had this resting scowl. And that just, she was so happy about that. And then finally, people tell me that they feel like they can compete at work again, male, female. That's, I think, a big reason why people are having surgery these days. So thank you guys so much. I really appreciate your time today. If you are looking to reach us and set up a consult, our phone number is here, 804-287-4229. And you can follow us on Instagram and see a lot more before and afters. We try to do some educational things. I'm at Dr. Langelier, and Leisha is at nurse.leisha.aesthetics. And you can find us at drlangelier.com. And so if we have anybody still with us after listening to us drather on for a while, let me know if you have any questions. And I'm just looking through here. And so, if anything's kind of a more personal question, I think easiest to just come in and make a consult. And let's see, okay.
I saw somebody, a little thing popped up, said they raised their hand.
Yeah, I see somebody raise their hand. I'm still trying to figure out this. Hold on one second. Okay. Ah. I promise I'm a better surgeon than I am technology person. Okay. At what point does insurance cover the upper eyelid surgery due to ptosis? Okay. So, each insurance is a little bit different, but generally what insurance is looking for is that the eyelid, whether it's the lid proper, ptosis, the lid droops down, or if it's the skin and extra skin and fatty tissue, they're looking for it to start to obstruct the visual field. So basically it needs to start to come down towards the pupil. A lot of insurances have a cutoff of 2 millimeters from the center of the pupil. Some insurance companies require visual field test. But when you come in, if it's bothering your vision, a lot of it depends on the pictures. So when I take pictures, a key important thing is that I really want you to relax your face. You know, when we see a camera come out at us, we have a tendency to lift our eyes open wider. And that's not what I want you to do. Now, I don't want you to be intentionally droopy because you may create the picture of problems you don't have. Like if I looked at the camera and made my eyes sleepy, that is not an issue that I actually have. I just want you to keep your face relaxed so that any heaviness does come to forward so that we can see it. But we will, look at what your individual insurance is and do any testing that needs to be done. And if we think you're a candidate, we'll submit it. I hope that answers your question.
Yeah.
Okay. And let's see. More. Yay! I see more pictures, more questions coming. Okay. Do you recommend a brow procedure with an upper eyelid surgery? It completely depends on every single individual patient and what they have going on. I would say the one time I might not recommend it more clearly is if there's a lot of brow asymmetry between the two sides because somebody has a droopy eyelid. Just because I'm really curious to see when I fix the droopy eyelid, if that compensatory brow lift goes away. I want to make sure I'm addressing the asymmetry that is permanent and fixed that isn't going to change in the future. But everybody's face is different. Some people just have heavy lids. Some people have heavy lids and brows. Sometimes I think somebody needs a forehead lift and I take my hands and I lift their forehead up and go, yeah, you don't look good like that. Let's not do it. Or somebody's health or downtime doesn't allow them to have the forehead lift too. So it really is a customizable kind of decision. Do I always conduct a visual procedure test? So no, if I don't think the pictures support insurance covering the procedure, I don't do the visual field test. I don't want to take up your time, my team's time. I also don't want to submit something to insurance that I don't believe is medical because even if they do approve it, there is a really nasty habit of insurance companies rescinding their approval these days after you've done the surgery, which is a very frustrating position to be in. So I very much want to try to support my patients getting procedures approved when I can, but I'm very particular to try to make sure I'm not doing anything that would get me in trouble because I like being an eye doctor and I don't look good in orange or stripes and I don't think prison food tastes very good.
No.
Just kidding. I don't think that would happen, but okay. Can you provide more before and after pictures for the TRL process? Great question.
Done that one too.
And so we can, I would say just come in and see us because some of them, it's much easier to talk people through it. It may not be something that everybody wants to see on this webinar because it's a little bit goopy. But the key point is that it provides a nice improvement for sure. And it really just depends on your individual skin. So sometimes I look at people and say, you're going to get a huge improvement. Sometimes I'll look at someone and say, I really don't think it's going to give you the improvement you're looking for that makes the downtime worth it. How long do surgical procedures on the eyes last? Great question. So I think a lower eyelid blepharoplasty, where we remove or reposition remove and or reposition fat is one of the longest lasting aesthetic surgical procedures you can do. Once you remove the fat, it generally doesn't come back. Sometimes 20 years later, in somebody who's really puffy, the little corners come back a little bit. It might come back a tiny bit, but not usually and not dramatically. It's very long lasting. Now, the wrinkles, laser, you will probably need to repeat the laser over time because we continue to lose that collagen and get wrinkles over time. Upper eyelid blepharoplasty, and some of the thinnest skin in the body. So even though when I do an upper eyelid blepharoplasty and I'm removing skin and I'm removing fat, again, usually any fat that's removed doesn't need to be done again. The fat part's usually good to go. Sometimes in the inner corner, which is some of the most vascular fat, that can come back a little bit over time, but it usually doesn't. It's more the skin. It's more that the skin can lose its elasticity and snap back, and you can get a little bit of skin folds again. It's going to vary. People who have really stretchy skin might notice that they have some drooping again in a couple years. But usually I think kind of the industry says like 8 years, but I think everybody's different. What I will say is sometimes people come in and see me and they say, I had a bleph done years ago, but my eyelids are drooping again. And that's when I say, nope, it's your eyebrows. So your lids are actually good, but if I take your brows and reposition them to their appropriate position, your eyelids are actually still perfect. So then there's a discussion of, what do we do next? Does that mean we have to do a brow lift? Or can we maybe get a little aesthetic improvement by doing a small blepharoplasty, making sure that your eyes still blink and close well? Is this something we can go after with Botox? Or is it something we just watch? Yep. Cool. I hope I answered all of those. Yay. This was really fun, everybody.
It was good.
Yeah. So I thank you so much for your time. Oh, I'm just going to see if we have one more that popped up. Do. Nope.
Maybe go to the chat just to see if
I'm
we're
just going to see if I
missing
missed one over here. Oh, you're so welcome. So some folks said thank you. I really appreciate your time tonight. This was really fun. I love taking care of my patients. I love working with Leisha. She's an amazing nurse,
Thank you.
one of the most hardworking
Same.
people I've ever met. And we'd love to take care of you. So if you have questions, please give us a call and I'll do my best to help you through your questions and concerns. Have a great night
Thank you.
and hope to see you soon.